Hello. So we will be seeing each muscle one by one. So the first muscle that we'll start with is the platysma. So the platysma is the most superficial muscle layer in the neck. It is a broad, thin sheet-like muscle that spans from the chest to the lower face. It covers the neck muscles and the superior portions of the pectoralis major in the chest. So it originates from the fascia covering the upper parts of the pectoralis major and the deltoid, and inserts onto the lower border of the mandible, lower lip, skin, and subcutaneous tissue of the lower face. So we'll see how it looks on a CT scan. So basically, we are trying to identify a muscle, a thin band-like muscle that lies deep to the subcutaneous fat. So here is this is get the pointer. So this, as you can see, is the skin, and deep to the skin, this is the subcutaneous fat. So this is the subcutaneous fat over here. So the muscle that is immediately deep to it is the platysma. So you can see it over here. It's not very clear. We will scroll down and see how it becomes more prominent. But this is the muscle that we are trying to identify. Deep to it are the muscles of your face and neck. So this is the most superficial muscle. So as we scroll down, you can see that here, and here where it's less crowded, you can see the muscle stand out. So this thin muscle here is the platysma. So this here is the platysma. So the skin, subcutaneous fat, and the platysma. So again, you can't identify it everywhere because sometimes it blends with the muscles. So you have to try and find a cut where you can see the platysma and then scroll up and down and identify it. So this here is the platysma. So the platysma is important because it forms the superficial limit of our neck nodal levels. That means all our neck nodal levels lie deep to the platysma. So in this cut, for example, this is over here is the level 3 because this is below the hyoid bone. So when residents usually contour this, when they are contouring the level 3, they tend to sometimes contour all the way up to the skin. So that's not needed. Your platysma is your lateral or your superficial limit. So you limit yourself at the platysma. This here anteriorly is the level 1b. So again, when you're contouring the level b, you're not going to contour up to the skin or into the subcutaneous fat. You will laterally limit yourself by the platysma, so your volume would come like this. So posteriorly it's continuous with the level 3. So again, here restricted laterally by the sternocleidomastoid, but where there's no sternocleidomastoid, you don't go up to the skin but limit yourself at the platysma. So here it's very clear. So this is the platysma. So we will see another patient. So again, we will start at the level of the sternum, manubrium sternum. So we are scrolling cranially. So here you can't really make out the platysma, but we will continue to scroll cranially. So if you look carefully, you can see a thin muscle here. That is the platysma. It may not always be very prominent. So we will continue to scroll cranially until we reach a slice where the platysma stands out on its own and we can really appreciate it. So again, here you can see this thin muscle just deep to the skin. This is the platysma. But I'm continuing to scroll cranially. So now it's starting to become much more prominent. So in this cut, if you see here on the right side, you can see this is the platysma and this is the platysma over here. So you can also appreciate that all the blood vessels and all the lymph nodes that you see over here are deep to the platysma. So that is the space that we are interested in. We are not interested superficial to the platysma. So this nice fibro fatty tissue here. So you can really make out the platysma away from your neck muscles. So this patient was a slightly bulky patient, so his fat planes are very clear. You may not have all patients like this, but when if you try a little and find a cut where platysma stands out, you can actually identify it. So this muscle is the platysma. So you can see here there is a lymph node. This is the level 1A. It is pushing the platysma a little bit. Yeah, there may be exceptions where lymph nodes or tumors may infiltrate the platysma and go into the subcutaneous fat. There, of course, you will include the subcutaneous tissue and the skin also. But normally, if this platysma is not breached, that will be your superficial limit. So again, this here is the platysma. So again, as we are going cranially, it's not as prominent. Yeah, so that's it. Thank you. So the next muscle that we will discuss will be the sternocleidomastoid. Thank you.